Now to the new report finding strokes in young coronavirus patients who previously were showing mild or no symptoms from the virus. Gio Benitez is outside the hospital in New York, where doctors first noticed the alarming trend. Good morning, Gio.
Hey, Robin, good morning to you. The doctor here at Mount Sinai says that some of these patients waited too long to come to the hospital because they were afraid of going in. Now this morning, he is sounding the alarm. This morning, a disturbing observation. Doctors seeing strokes in young patients infected with the novel coronavirus. What's worse, these were people quarantining at home, most with mild symptoms.
These patients were all in their 30s and 40s. 2 had no underlying conditions. These are not particularly sick patients.
Neurologist Dr. Thomas Oxley is behind a case report to be published in the New England Journal of Medicine, which calls it an urgent communication, an effort to rapidly notify the medical community of these findings. He and his colleagues at Mount Sinai in New York saw 5 COVID-19 patients over the course of 2 weeks who were under age 50 presenting with strokes at the hospital. When did you start noticing that blood clots were an issue?
I did one of these procedures weeks ago, and it was in a young patient with no past history who'd been at home with COVID. And so that struck me as unusual. And then we saw a run of patients in the same category.
Strokes are caused by blood clots. Chinese doctors have reported clotting among COVID patients, and now American doctors too. 49-year-old Michael Reagan thought he was recovering from COVID-19, but scans of his lungs showed multiple blood clots.
So you were feeling pain in your lungs?
Yes, intense pain like I would imagine a heart attack would be like. I am in my 40s. I have run marathons. I was a yoga instructor, vegan, and if I can get this ill from it, anybody can.
Now doctors at Mount Sinai making the decision to treat as many patients as they can with high-dose blood thinners before they even see evidence of clotting. Now, needless to say, more research is needed, but the doctor says that if you have any symptoms of a stroke, so that's arm weakness, facial droop, speech disturbance, call 911 right away. Amy and Michael.
Yes, so important, Gio. Yes. Thank you. This is very scary to hear and see, and so let's check in with Dr. Jennifer Ashton now for some expert opinion about this. So how concerning are these findings to you, Dr. Jen?
Well, Amy, it's painting a picture of some of these critically ill COVID patients as being incredibly sick and challenging to take care of. They're showing features that are perplexing and atypical in viral illness that people are still trying to make sense of. And remember, it's not just stroke. When you talk about neurologic effects, data out of China suggested there were things like headache, seizure, dizziness, loss of smell and taste seen in as many as 36% of COVID-19 patients presenting to the hospital.
And Doc, all throughout this pandemic, we hear that people with underlying conditions fall most seriously ill from coronavirus, but now there's a study proving it.
Exactly. Just released last night, Michael, in JAMA, the largest U.S. clinical case series, almost 6,000 patients in New York State, showing, and take a look at these numbers, those admitted to the hospital definitely more high risk. 57% of them came in with a pre-existing diagnosis of high blood pressure or hypertension, 41% with obesity, and 34% with type 2 diabetes, making them much more high risk for complications.
And Dr. Jen, it's important to note you have been reporting that COVID-19 has the potential of impacting the entire body, correct?
That's right. Literally head to toe, Amy. Brain, heart, lungs, kidneys, intestinal tract, skin. We are seeing head to toe manifestations. And so far, this virus really looking like a bad actor.
All right, Dr. Jen Ashton, we appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.